Welcome to this educational program. This module discusses treatment options for Peyronies disease. It is hoped that you will already have viewed the presentation entitled Understanding Peyronies Disease prior to this one. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Peyronies disease is a condition that leads to scar tissue that can cause the penis to remain either curved, bent, deformed, or shortened during erection. Early on, it can cause pain during erection. Peyronies disease can also cause erectile dysfunction, a situation where a man is unable to obtain or maintain an erection. Once the diagnosis of Peyronies disease is confirmed, you will be eager to learn what can be done to manage it. The goals of treatment are twofold: to reduce any pain you may be feeling upon erection, and to allow you to reinstate your sexual activity to satisfactory levels. At this point, it must be emphasized that when seeking treatment for Peyronies disease, the primary responsibilities of your doctor are to make the proper diagnosis and to work towards a good functional result, whereby you will be able to achieve a functional enough erection to have intercourse. Obviously, he or she will strive toward the best result possible, but in some situations, a perfect functional and cosmetic result is simply not a reasonable goal. In order to understand the approach to treating Peyronies disease, it is important to understand the so-called natural history or evolution of the condition. In most men, Peyronies disease comes on quickly and is associated with a period of painful erections. This is called the early or active phase, where an active inflammatory reaction is taking place. Scar tissue develops and changes in this time. During this period of active inflammation is probably the best time to consider non-surgical medical therapies that might alter the inflammatory process. While waiting, it is also recommended that if you are still sexually active, you may want to modify your methods of sexual activity in order to cause less stress and bending of your penis and prevent further scarring. Pain will resolve within 1 year in 94% of men as the condition stabilizes. During this process, the scar tissue in the penis will actually diminish or disappear in 13% of men, stabilize in 47%, or worsen in another 40%. By 1 to 2 years, the final result of the process is usually known, and the condition enters a long-term or chronic phase. It is at this point that surgery will be considered for men where the disease is causing significant functional problems. As mentioned, medical treatment is reasonable to consider in the early active phase of the disease. Many men will improve or stabilize and do not need surgical treatment, and treatment should only be sought if there is significant functional impairment. Such functional impairment is uncommon for curvatures of less than 30 degrees. Medical treatment for Peyronies disease may include pills taken by mouth, injection of medication directly into the scar tissue plaque, and, where necessary, treatment of any associated erectile dysfunction. ED is dealt with in its own separate module. There are no currently proven effective pills that can be taken by mouth to reverse the changes of Peyronies disease. There has been much material published on the use of vitamin E, PABA or para-aminobenzoate, the anti-gout medication colchicine, and the anti-cancer drug tamoxifen. However, their benefits are not proven and not all doctors use them. Vitamin E has antioxidant properties, and in theory, it should counteract the release of free radicals that are involved in this condition. It has been recommended to take 400 international units per day during the early painful phase of the disease in the hopes that it might shorten the duration of pain and lessen the progression of plaque formation. Vitamin E is commonly combined with colchicine, and this combination, or vitamin E alone, is the most commonly used medical therapy in Peyronies disease. There is no scientific evidence for holistic remedies in treating Peyronies disease. However, many approaches have been tried and recommended. Improving nutrition by eating a balanced diet rich in fruit, vegetables, legumes, and whole grains, and avoiding processed foods, refined carbohydrates, and caffeine, as well as quitting smoking, may help keep your immune system functioning well. Certain herbal remedies have anecdotally, but not scientifically, been shown to help with Peyronies disease. Both bromelain, a digestive enzyme, and gotu kola are believed to target excess connective tissue, similar to that found in Peyronie's plaques. Western physicians are more likely to prescribe vitamin E for its known antioxidant properties. Consult with your physician before trying any non-conventional remedies. Medication can also be injected directly into the Peyronies plaque, and many have been tried. Currently, the most widely used for this is a drug called verapamil, which is in a class called calcium channel blockers. This drug may work to break down the plaque, soften it, and lessen its impact on erections. These injections should be given under the care of a urologist and must be given regularly in order to have an effect. Steroids and collagenase have also been injected into Peyronies plaques, but there is no evidence to show that they have significant benefit. Several interesting therapies have been tried to break down the plaque of Peyronies disease, including radiotherapy, electromotive drug administration, or EMDA, where therapeutic drugs are driven into tissues by an electric current, and extracorporeal shockwave therapy, or ESWT, where shockwaves are used to break down the plaque, similar to how many kidney stones are treated. Unfortunately, all of these treatments are cumbersome, expensive, and unproven. Therefore, at this time, none of them are recommended treatments, and they remain experimental only or for cases of persistent pain where nothing else has worked. When more conservative approaches fail, there are surgical options. Surgery includes operations to straighten the penis or the placement of a penile implant or prosthesis. Straightening procedures include those which shorten the side opposite the plaque and those that attempt to preserve length by cutting or removing plaque and placing a graft into it. These are discussed in detail in the next slides. The Nesbitt procedure, or a variation of it, is the most commonly performed operation for Peyronies disease. This operation is usually done as an outpatient, meaning no overnight hospital stay is required. In this operation, the tunica albuginea on the side opposite the bend is either cut or a small piece of it is removed. The edges are then sewn together to even both sides and thereby straighten the penis. This operation works well, but does have the downside of shortening the penis a little bit, usually 1 to 2 centimeters. This slide shows how a small piece of the tunica is removed on the side opposite the plaque to tuck in that side and straighten out the penis. Note that no attempt is made to remove the plaque and that the penis is very slightly shortened in this process. Good candidates for the Nesbitt procedure are those with Peyronies disease causing functional difficulties that have reasonably good erectile function, normal penile length, and any degree of curvature. The Nesbitt procedure is the simplest operation available that does a good job of straightening the penis, and is the least likely to cause complications such as erectile dysfunction. Satisfaction rates with this type of surgery are in the order of 75 to 90%, and the penis can be completely straightened in 60 to 80%. It is imperative to keep in mind that the goal of this procedure, like all others for this condition, is to restore functionality first and foremost. Cosmetic results are secondary, and unfortunately, with all these surgeries, the penis may not end up perfectly straight. It is also important to understand that the penis will be shortened slightly following the Nesbitt procedure, and this is explained further on the next slide. Finally, erectile dysfunction and changes to sensation of the penis can occur if cuts must be made near the nerves to the penis. This happens most commonly with patients who have downward curvature because the cuts and stitches have to be placed on the upward side where the nerves run. The degree of penile shortening after a Nesbitt procedure is usually quite small. 85% of men have less than 1 centimeter of shortening, while 10% have 1 to 2 centimeters, and only rare men have shortening more significant than that. Only 1 to 10% of men will actually have sexual difficulties related to this shortening. It should be pointed out here that these data are derived from several small studies and the numbers are quite variable. Your doctor will advise you of his estimates in your particular situation. Complications other than shortening following the Nesbitt procedure can include erectile dysfunction in 0 to 23%, reoccurrence of curvature in 8 to 11%, hardening or narrowing of the penis in 0 to 17%, bothersome suture knot or scar at the site of suture in 0 to 2%, and loss of sensation to the end of the penis in 0 to 20%. Again, these data are derived from several small studies, and the numbers are quite variable. Your doctor will advise you of his or her personal experience. Some surgeons, for milder cases of Peyronies disease, will perform what is called a plication procedure, whereby the tunica is simply folded in on itself in a few places until the desired result is achieved. This is similar in principle to the Nesbitt procedure, but does not involve cutting into the tunica, so is less invasive in that sense. Data from these procedures are again difficult to present as the studies are very small and different surgeons use different techniques and also report things differently. From some of these studies, however, it is suggested that the procedure can be safe and effective. Satisfaction rates range from 60 to 80%, with good straightening in 60 to 85%. Complications again may include reoccurrence of curvature, bothersome suture knots, painful erections, loss of sensation, and erectile dysfunction. In an attempt to preserve the length of the penis, the plaque can be incised, meaning cut, or excised, meaning completely removed, and the space created can be filled with a graft of material. A graft is a piece of tissue or material used to fill a space or support an area. In this case, the graft material may be the patient's own tissue, such as a piece of vein from his leg, or it may be foreign tissue, such as specially processed piece of pig intestine. This is more complex surgery and performed by specialists in this field. While it can maintain the length of the penis, compared to the Nesbitt procedure, these operations do have a much higher risk of complications, including erectile dysfunction, and scarring at the area may mean ongoing curvature. This slide shows an illustration of how the plaque is removed, then the space is filled in with a grafted tissue consisting of pig intestine. In this case, a cut is made into the plaque, creating a space which is then filled again with some type of graft. These operations are performed much less commonly, and usually by very specialized surgeons. They are usually reserved for more severe cases of significant curvature, or a so-called hourglass deformity, and cases where penile length cannot be lost. Erections must be adequate. Because the cases are more severe to start with, and the techniques vary widely, results are extremely difficult to present. If one of these procedures is recommended to you, ask your doctor about his experience. Complications reported from these operations include erectile dysfunction, shortening of the penis, loss of sensation, reoccurrence of curvature, collections of blood, and complications of harvesting graft material if done. When Peyronies disease is accompanied by significant erectile dysfunction, the best treatment options to deal with both issues in most cases is placement of a penile implant or prosthesis. These may also be the best option when there is very severe scarring in the penis, making a straightening procedure less likely to succeed. If ED is mild and can be successfully treated with pills such as Viagra, Levitra, or Cialis, then it is reasonable to consider a straightening procedure. However, if the ED is more severe, then an implant is a better option. There are different types of implants available, ranging from malleable rods to inflatable devices. A separate module is available discussing these in more detail, and if you choose this therapy, your doctor can advise you about the best kind in your situation. Peyronies disease can be a difficult diagnosis to face for many men. The good news is that there are management techniques and treatments available to you if you are diagnosed. Furthermore, there's a great deal of interest in research into Peyronies disease. Through studies in animal models and cell cultures, scientists will learn how Peyronie's develops at the level of molecules in the immune system, and the cells in the tunica albuginea. This will lead to better treatments through the development of effective drugs. Through animal studies also, scientists will be able to refine surgical techniques and are continually aiming for improved results. Alternative treatments are also being explored and may play more of a role in the future. In summary, the primary goal of treating Peyronie's disease is to optimize sexual functioning with the least invasive therapies possible. The early or active phase of the condition involves an active inflammatory process. During this phase, you may wish to consider medical treatment, such as vitamin E or other drugs. Injections may also be tried to soften the plaque. In most cases, pain will resolve completely, and the curvature or deformity will eventually stabilize. In some men, it diminishes or goes away. In others, it worsens, and in many, it simply stays the same. Surgery is the treatment of choice if and when the curvature, deformity, or erectile dysfunction associated with Peyronie's disease limits a person's ability to function adequately. This slide lists some of the many resources available where you can find more information about Peyronie's disease. These current references were used to assist in the preparation of this module. All of these are available through your local medical library if you are interested in more detailed reading on this subject. These references were also used. We sincerely hope that this module has furthered your understanding of treatment for Peyronie's disease. We wish you the best for the future, and thank you once again for viewing this educational program. Early on, it can cause pain during erection. Peyronie's disease can also cause erectile dysfunction, a situation where a man is unable to obtain or maintain an erection. Once the diagnosis of Peyronie's disease is confirmed, you will be eager to learn what can be done to manage it. The goals of treatment are twofold: to reduce any pain you may be feeling upon erection, and to allow you to reinstate your sexual activity to satisfactory levels. At this point, it is important to understand the so-called natural history or evolution of the condition. In most men, Peyronie's disease comes on quickly and is associated with a period of painful erections. This is called the early or active phase, where an active inflammatory reaction is taking place. Scar tissue develops and changes in this time. During this period of active inflammation is probably the best time to consider non-surgical medical therapies that might alter the inflammatory process. While waiting, they reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Peyronie's disease is a condition that leads to scar tissue that can cause the penis to remain either curved, bent, deformed, or shortened during erection. It must be emphasized that when seeking treatment for Peyronie's disease, the primary responsibilities of your doctor are to make the proper diagnosis and to work towards a good functional result, whereby you'll be able to achieve a functional enough erection to have intercourse. Obviously, he or she will strive toward the best result possible, but in some situations, a perfect functional and cosmetic result is simply not a reasonable goal. In order to understand the approach to treating Peyronie's disease, welcome to this educational program. This module discusses treatment options for Peyronie's disease. It is hoped that you will already have viewed the presentation entitled Understanding Peyronie's Disease prior to this one. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily